we ran into the flu season of late 2017, the beginning of 2018. One of the things that we do, and we've always been very proud of, and I told PatientBond multiple times that we would not be changing, was our callbacks. My staff calls back every single patient. I have a member of my staff call back every patient. So what happened during the flu season was, because of these enormous volumes that we were having, my team literally was going home 2 hours late. If we normally saw 500 patients, we were having days where we saw 1,200 patients. They were going home 2 hours late, 3 hours late, and hadn't made a single phone call all day long because patients were in the waiting room the entire time. I mean, this was a rough flu season in terms of sheer numbers. The fact that the flu immunization last year didn't cover all the strains by the time they had mutated and traveled just made it a really rough flu season. And Missouri's in the middle of the country. We tend to really be the crossroads of a lot of traffic, and so Missouri, by some estimations, had the highest incidence in the United States during some weeks. So in any case, from the point of view of us helping people who are sick, this was a great opportunity. But my callbacks were getting 1 day behind, 3 days behind, 5 days behind. It doesn't do as much good to call someone 8 or 10 or 12 days later to tell them that you really care about them, because it rings a little bit hollow. If you really cared about me, you'd have called me the next day or 3 days later, which was our usual paradigm. So at this point, my leadership team came in and said, Dr. Dinkel, what about PatientBond? And I had to think about it a little bit, especially since perhaps I was being a bit prideful about the fact that I said we weren't going to do this. But of course, PatientBond did not hold me to my pride or say I told you so. They were fantastic. They came up to the plate, and they actually helped me dig out of these 15,000, 16,000 calls that I was behind, and immediately automated a process where if a patient either wants to talk because they picked up the phone, wants to talk to one of my team leaders, is sent there immediately, or wants a call back and later on decides or pushes one. So they have an option for a callback, they have an option to talk to a team leader, and if they listen to their voicemail, they have a number that they can call back. And when they do, my team gets an email, and I have a few senior people that are very good at making these calls for people that have specific questions. So in the end, this ends up being better. Now, do I believe that every single patient, that people don't get annoyed by automatic calling or recording? Yeah, I'm certain that they do, but the reality is every single person had an outreach. They know that Total Access Urgent Care cares about them. We did not say we're selling you something. We're just calling to check on you. And the people that really had questions, and a lot of these are very simple to solve questions, that if they're not solved cause a really big problem, because the person doesn't know exactly how to take their medicine, or exactly what this discharge instruction meant, or exactly when they're supposed to follow up with their doctor. My team can answer those very quickly, and they really cause people's health plan to go off, the health progress to go off the rails. So this allowed me to remain constant, not ever lose any sheets or days of information in manual processes that are being done by humans, have my more expert, smaller cadre of people talking and answering these questions, as opposed to perhaps a brand new tech that might not handle the question very well. So overall, even though people don't like, and I mean, it is, my original observation is true, people would rather hear from a human being, the reality is that overall this system is better, faster, more reliable, more accurate, less expensive. And the people that generally need to ask questions get to call and ask a senior member of my team who absolutely always has the right answer, or can get the right answer very quickly. So it was a dramatic improvement. And while I still don't engage all of the different powers of PatientBond, I think it's another testimony to the fact that PatientBond is so good at, and I haven't met any other technology company that has done this for us, at adjusting to our needs with things that they have on the shelf, and realistic tools that they can use to allow us to continue to support this theme upon which they were built, which is this engagement, this bond, if you will.